Hello, it's Eileen from Facial Rejuvenation Med Spa. Welcome. At my Med Spa, I have created evolving concepts for a relaxed, sophisticated, and serene experience for each one of you. I have more than 2 decades of treating clients, and I have discovered that the three most important things the complexion concerns, about our lips, mouth, and chin area, and finally the eye area. So we'll get started. I perform a comprehensive consultation for everybody that comes here. And what I like to do is everybody gets together to learn, and we will start right now with the glow gum method. And that involves prevention, rejuvenation, and correction. First, we'll get start with the complexion concern. And I use professional micro channeling called ProCell, and it is a stem cell science. I have a little picture of it here so nobody gets upset about anything. And the first question is, does it hurt? No, it doesn't, because I have a BLT, or a numbing solution, that I gently put on after I wash your skin. We put on the numbing, and that lasts for about 7 minutes, as you can get relaxed and have no concern about any discomfort at all. So this ProCell professional microchanneling system, it helps to tighten, tone, plump, and retexture your skin tissues to improve the appearance of your skin all around. We all worry about things and have concerns about fine lines, wrinkles, scars from acne, stretch marks, injuries, and post-surgical procedures. So you may ask, how does this micro channeling work? It creates invisible. First off, I have a sterile tip that I use that is helping me make invisible channels for you. And that way I'm able to get the solution into your collagen and elastin. And the next thing I do, we're always trying to stimulate at the production of collagen. So this will get great results because it penetrates in with a growth factor serum. And that growth factor comes from stem cells from bone marrow. Everything is safe, it's well protected, and growth cells continue to produce. So we have plenty of them to utilize for our ProCell. What I'd like to say is that the serum comes protected. Everybody has a sterile vial. You're completely numbed up, and then we'll put the growth serum on your complexion. Then go ahead and start with the ProCell invisible microchanneling. That most persons that come, feel like they want to have great results with no downtime. With the microchanneling, I use a LED light after I've done the channeling to help to decrease any type of inflammation, and it's a comfort. And along with a mask that I put on after we have done the microchanneling for you. And the mask puts in lots of enzymes, almost the super enzymes of vitamin C and E, and we're using some B5 now to create a good smooth skin surface after the microchanneling. So now what I like to say is that when you go home after microchanneling, I utilize something called IS Clinical. It's a reparative moisture. And there's a zillion moisture creams out there, but I find that the IS Clinical Youth Program saturates in and gives you comfort that evening, and then the smoothness of your skin continues to help to decrease those fine lines. I also find it very helpful to be using the PCA vitamin C. If you're going to go out in the sun, we all try to be very careful about that, but we put a little bit of C and E before we add to the sunscreen to protect your skin after you have had your micro channeling completed. Generally speaking, there's about 3 different sessions, about 30 days apart. That allows your skin to rejuvenate and prepare for the next series of the ProCell for the collagen growth and the elastin. So the second concern I have with patients is about the lips. We always are talking, and the lips are used 24/7 because when we sleep, we're breathing and drying out the inner part of the lips. We have 4 layers to the lips, and shows part of our aging and our general health. The microchanneling, the reason I keep emphasizing that is because we have advantages to do a lip lift with microchanneling. As I mentioned, we have the great numbing, so you don't have to concern yourself. And probably about a year ago, we've designed a technique to be able to microchannel your lips and your chin and this area where we get some sagging that is very bothersome to many, many patients. Uh, the safe way of the only problem that you would tell me, I do a very comprehensive consultation. You would want to make sure that you don't have any problems with breaking out around the lip area. And we want to, when we lift the lip, we also are creating fullness for you. Um, and then with the chin and the uh, jaw area, we tighten that up so that the power of gravity is halted a little bit. I'd like to say that after the lips are done, we just don't come here and I do this. I think it's a great procedure, micro channeling. I like to say that IS Clinical. The reason I put these up is I studied so many different parts, but this is a 2-step process for you to utilize at home. It's a very gentle scrub that you do in the evening or in the morning time, whatever. And then there's a elixir that we put on your lips that protect the 4 layers of the lip tissue to keep you plump after and firm after you've had your micro channeling. The Lip Duo is brand new and it has the hyaluronic acid in it. It has a lot of the copper and of course E and C, everything that seems very routine and common. The way we are developing each of these products come from all MD approved. So I feel very comfortable that they've been well researched and I can endorse them because I work with them daily. The lip area, of course, with the chapstick, sometimes if you over just do the top layer, then you're getting a reflex of drying out the top layer of the skin. So you're adding more just the chapstick. The Lip Duo it is guaranteed to really moisturize the lips for all of the duties that you need to do with your kissing and all of those good things. The next part of the concerns we have is all about your eyes. And our eyes, the skin around your eye is the thinnest layer of skin that in the entire body. If you want to compare or contrast, you'll find that the sole of the foot is the thickest. So you can imagine that how we use our eyes all the time, and even when we're sleeping, if I rub the eyes, we'll get some damaged skin around it. Again, the part of our workshop today is to leave you with a feeling that this micro channeling is very beneficial for the concern around the eyes. I am an eye nurse, an eye specialist, and I'm able to help you very around the eye very carefully to create some of the crepey tissue that's developed. I also am able to, while I'm doing the procedure, focus if that's an area where we want to get a little lift on the forehead. And then we're utilizing the stem cell serum as well. I find that the eyes, I can recommend a lot of different creams. And I certainly on my website can talk to you about anything or afterwards. The Elastin eye cream has a technology called the trihex. And what we're trying to do is smooth the skin underneath the eyes for the very fine lines that come out and the dark circles. And if we can try to create, with not using too many cover-ups and concealers, if we try to make the tone of the skin even, then we have less of a problem with dark circles under our eyes. Um, I recommend, believe it or not, everybody, our ages have different types of aging of our skin. Our eye tissue starts to change in our 20s, and that's quite young. So I do recommend that in the morning AM regimen and a PM regimen is to add to your eye cream every night. It's something that plumps up and takes good care of those very delicate tissues. I always can tell when somebody's using their eye cream, especially after we've done some work with the microchanneling. Uh, you're going to have a lifetime of having good skin in this area. The elastin is well tested, so it can be utilized around the eye. It has pure and clean ingredients for you. And of course, it's MD approved and studied, so that's very, very important to do. My med spa is, as we said, we're located in Newtown Square, and it's combined with a company called True Beauty. And my partner in crime does beautiful work for weddings and has been here in the location for about 10 years. So it's a teamwork that we have set up. When you want to book any of our treatments, and if you're comfortable, uh, you always can call me or text me, and we're going to start online booking. But now I'm looking at myself too, and I think after a long day, we're looking at the three concerns about our skin concerns, fine lines and wrinkles, talk about our lips. We talked about our eyes and using the elastin. I'd like to just give you these little treats. This is a glass ball that just got developed, and you can put them in your cool freezer. But after being on Zoom all day, working all day, your eyes feel very, very tired. These little glass balls are very safe. I always use that word safe because you're around the eye area, to just enjoy a small self massage of the eye area. And let's say once everything starts opening up and we're allowed to go out to dinner, we can come home and freshen up and utilize our globes just to make a little puffiness. Maybe we've been eating some food that are not the best for us, or the stress level is tricky. So please know that you can do self-help situations at home, utilizing the products that I recommended, help out, and then utilizing the globes. All treatments start with a consultation, and I'll speak to you and get a full understanding of your concerns to how I can help you. The consultation is complimentary. It has a value of $100, but it's the essential part of having good care and good care for a lifetime of your skin. I remember. So what I'd like to say too is that when you have all of these issues coming about the three topics we talked about, your skin concerns, your lips, and your eyes, one of the issues that we're really doing nowadays is combining everything. When we do the consultation, you may say, oh, Eileen, I have one big concern and I can work on that. If you have the three concerns during a treatment procedure, we can spend the time on each area so you feel like you have gotten a complete and full treatment at my med spa. I recommend also, when you come in, there will be just, everything's online now, but your medical history will be important. So I can customize any of the treatments and anything that we use. When we're treating your skin, the skin does talk to you about your overall health. I can tell if it's been dry or environmental problems and or stress. When I think about you also, and the three concerns, I also say, what do you do, Eileen? What's the one thing that everybody that's watching, no matter if we're 20 years old or we're 100 years old, my oldest patient to come in is 89. The youngest is a teenager with acne. So I see the broad scope of patients. I found about 20% now men are starting to realize, probably because of Zoom, they're either growing beards or coming in to see us here at the Facial Rejuvenation Med Spa. But what I say to you is everybody says, okay, I'll come in and have a consultation. I understand that you have many things to do, but this micro channeling has so many advantages that it may be the right direction for many people to get started and know it's safe if you have not been coming into med spas like this. So now that one fabulous final thing, and I just put this up here because it's always tricky to know what to do, but this is a body serum. And everybody is trying to keep the bodies. We're all going to the gym, thinking about summertime now with bikinis and or bathing suits or tank suits from swimming every day. This body serum allows you, after you've been all day in the sun, but with good sunscreen on, and you wash, you can use this youth serum that is filled with copper, vitamin A, vitamin E, hyaluronic. It seems like the similar things, but the way that this company, IS Clinical, has developed it, it's so easy to use and it absorbs very nicely into your skin. It's used for guys and women. I just cannot say enough about it for an overall process with your body temperatures and views. Next thing we'll start to talk about what is when you come to this spa. We do take time. We have one person at a time come in, and we'll keep that process going until we're told not to do it. But the time you come, it will be very serene and relaxing. You can spend an hour or up to 2 hours. You can also decide to come in a group, and my co-partner can be doing some work, and I can be doing some work, and you can make it a very nice afternoon spa experience for you. Very fine. So what I'd like to go over is that many times persons will say to me, all right, Eileen, I've come in and I've gotten, you said something about combining procedures. What does that mean? In addition to what we discussed about your skin, your lips, and your eyes, we can combine procedures so that if you want to have the microchanneling and a peel, it's safe to say what will work nicely for you. If you need some exfoliation, if you're having trouble with dryness, we can work on that. We can also increase the oil and the natural glow to your face by doing a lot of the procedures that we have. The next aspect of the med spa is that we've talked about the 3 concerns, which I think are essential, and I hope I've hit home that we have a solution for the concerns of your skin. One of the things I'd like to say is that our facial rejuvenation, when I do a consultation, I also am looking at the total body, because sometimes you may have little concerns with your hands and different areas. So what we do on the face, if we're able to do it on your face where we see it every day, I'm able to utilize the Pro Cell and different types of tips for different types of procedures for you. So you don't have to limit what we discussed at this workshop. I'd like you to come in and see the variety of things that I'm doing. We don't just stop at one thing. We have areas of the body, which I'm alluding to now, is your neck area and your décolletage. A lot of times women are interested in the elbow area and the knee area. As we are working out, if we have lost a little weight, we also have, that's why as a nurse, I can do a full body consultation and we can talk about those different areas for you. Great. So I have some questions from Sarah. How should I layer my products? You know, that's a great question. And we always think of things that, Sarah, always wash the skin. And you think about the clear things that go on first, then the creamy things. So by the clear things, I would mean your serums. And I have a series of serums that have some things that are just brand new that are filled with vitamins to just enhance what you're doing. Wash your skin, apply the serums. Serums can just be done about 5 little drops. We always start up here, down in here, and here, and then gently massage the serums in. It's okay. Many times with the peptides, some patient or clients will say, Eileen, how many serums are you asking me to do? Sometimes we use a serum, vitamin C serum. Next, we'll use a serum that has for properties of brown spots, and that will be a Kojak serum. And then we'll start some creams. We'll want a cream that is a reparative. I showed you for the IS Clinical has a terrific reparative moisturizing cream. We would put that on, and then the sunscreen. And then at nighttime, we wash our face. We can use the Retin-A, which I didn't address too much. It's a vitamin A. We have revolutionized Retin-A from the last 35 years. And now we have very delicate Retin-A that's very mild that we can mix in with our moisturizers. I recommend that many times that I take the very light amount of Retin-A mixed in with an eye cream and gently from the outer area, put the eye cream in. And even at nighttime, you can add just a touch of oil just to keep that going. That's safe around your eyes. So it fills in nicely. So Sarah, I hope I've answered the question. That is the clear serums first, wash clear serums, and then the white creamier things, and then the sunscreen. Great question from Jen. Hi, Jen. I don't see your face, but you're there. How long does micro channeling last? Well, it will last a long time if we keep the collagen and elastin rejuvenating. And we penetrate like I said, the growth cell factors keep on working. And that's a proven scientific fact. So when I use the growth serum in the micro channeling, then that 30 days, it penetrates into the collagen and to the elastin and continues to enhance and help the collagen grow. Remember, we're trying to take very flat cells that want to age, and we want to get rid of the flat cells, and we want those happy, vibrant new cells to be proliferating so that we get nice, thicker skin and not the saggy thin that likes to happen. So the channeling works a lifetime if you keep going. I do tell you that 3 micro channeling are important to get the skin accustomed to it. And then using some home products, I can sit here and tell you that my patients have had great results, and they are come back, even a year I haven't seen them, they'll come back for a series of 3. Okay, Maggie, should you use different AM and PM products? I do believe you should, Maggie. In the morning time, I'd like you to think of waking up and how we usually have our glass of orange juice or an orange. In the morning time, you start out with your serum, a C serum, and which is good, and then the A, and then a lot of this copper is coming out. And then we have a polyvitamin from IS Clinical. When you come in for the consultation, I can go over all the details. But those serums in the morning time. So we say C in the morning and moisturizer, sunscreen. In the evening time after you've washed, I like the Retin-A. And depending on your skin type, and I can decide that, I have methods and ways of evaluating that for you. The Retin-A works during the nighttime to rejuvenate. And we've known about Retin-A for now 35 years. Before we used to just take it and put it on our face. Now we have it mixed and microionized with a lot of other good products. So nighttime would be wash, Retin-A, and a nice thick, you don't have to have a thick, but a luxurious night cream. as you go to sleep, and it doesn't get all over your pillows and make a mess, and it smells just neutral, so you don't have any of those worries. But that helps to protect your skin from the sleeping at nighttime. And so I would do that. During the day, I also recommend like a little misting. Days like today, we've all been busy, and now you sit. Thank you very much, everybody, for tuning in, but listening, and then it'll be dinner time and family time. So Colleen asked, what products should everyone have in their skincare routine? We all need the products. I will emphasize that the vitamins are important. Polyvitamin serums are excellent. I now have with the IS Clinical a vitamin C that penetrates in that I'm getting terrific results. And these serums help tighten the skin up. So if you only had to, washing your face is important. I find some clients say that they get allergic to things very often. I take that out in the consultation, but a good wash, something that it makes, you don't have to scrub your face, but a clean, gentle wash. I find that the Elastin wash, I particularly use it because it cleans nicely and doesn't leave any residue. And then my skin is ready for the other serums that I put on. So what else I would say is always, depending on your age, 20-year-olds don't really start to show any problems with their skin. So I would say if you're 20, to make sure that you have a good wash and a great sunscreen and, a light moisture, light dewy. If you begin in your 30s, I would definitely say wash, definitely some C serums. If you're starting to show brown spots from the skin, I'd give you a brightener so that we keep the melanocytes at low key so that that they don't want to multiply. If a melanocyte, which is a brown spot, is left untreated, then 2 come, and then 4 come, then 8, and then 10, and then we have lots. So that if you're 30 into the 40s, I would definitely add the Retin-A. It's a way to help these cells. Remember, it's always about cellular and slowing down the cells of getting them old, and we're trying to keep them vibrant. So the Retin-A. At 50, I would say definitely much more luxurious, luscious, moisturized cream because of the hormonal changes. Definitely would recommend a higher level of serums that have the E in it and the copper that will be giving you some hydration. If you're in the 50s, I would definitely get into, even the 40s, a monthly peel that we do different things for you that help to rejuvenate the skin on different levels. Sometimes we'll come in for some reason, the skin will be inflamed. So I will do procedures that help to decrease inflammation. Sometimes we'll come in and the skin will just be irritated or dry, or some people are making too many oils and you get clogged pores. I work very diligently to help to unclog the pores and a series of almost 8 different types of masks. In the short workshop, I can't say everything we do, but if you know that we're able to go over the skin concerns, we can break that down into microchanneling and some of these product lines. The lips, we want them to be luscious, so with the lip duo, it works nicely. And of course, the eyes have it. I have one more question. How do you make appointment to come here? And easily, we have calls and with emails, text messages. I take all my own text messages if you'd like to. I'm always available for any types of phone calls or information. Anybody that knows me for the decades that I've been practicing, I like to be very available for any concepts. I do go to lots of meetings. I try to bring the latest information back to you. That's why some of these product lines I studied during the last, 9 months that we've been not going to meetings so much. And so I have lots of information to share with you about that. So the next part of what I'd like to say to you is that please come to the facial rejuvenation in Newtown Square, where you can have all of your rejuvenation needs met. Bye-bye.